Okay, this is part 3 of the bacterial biofilm and biopesticide hypothesis and the connection to Morgellons. Biotine, it's a PBF mouthwash. Normal mouthwashes can only clean the surface, which is why bad breath returns quickly, and gum disease is a constant problem. And I'm going to add that bad breath or halitosis is a biofilm issue with sulfur dwelling bacteria. With a new patented technology, Biotine PBF mouthwash, you can dissolve the biofilm, expose hidden bacteria colonies, and kill germs. In addition, Biotine PBF contains the proven LP3 salivary enzyme system to strengthen the body's antibacterial action. So this is one of the innovations that came out of this research, was Biotine mouthwash. Yeah, so hopefully this video on biopesticides isn't just all about a mouthwash commercial. I'm just teasing you, we know it's more than that. So N-acetylglucosamine and biofilm. Let's see. Effects of chitosans with different molecular weights on Streptococcus sanguis biofilm. Purpose is to investigate the effects of chitosan and Streptococcus sanguis biofilm methods. Streptococcus sanguis biofilm was formed on the saliva-coated glass. A flow culture system then exposed 2% chitosans with different molecular weights, 3, 10, 30 minute. Confocal laser, scanning microscopic and vital lead fluorescent staining technique, vital stained green, dead stained red, were combined to observe the biofilm thickness, bacterial density. Analysis of virulence was used for PMID. Results is that the biofilm thickness and bacterial density reduced significantly after treatment with 2% chitosan. Low molecular weight chitosan seemed most effective at detaching biofilms. The next method that was discussed is probiotics, IBD, in biofilms. Microbial biofilms in the human gastrointestinal tract. The human gastrointestinal tract contains rich and diverse microbes along its length. However, while extensive studies have been made on luminal bacteria communities in the gut, less work has been carried out on organisms growing in biofilms, where individual groups of bacteria exist in a multiplicity of different microhabitats and metabolic niches associated with mucosa, the mucus layer, and particulate surfaces in the gut lumen. Bacteria and yeast also occur in biofilms attached to artificial surfaces and devices implanted in the hosts, such as patients being fed via enteral tubes. Although we are just beginning to investigate the composition and metabolic activities of these structures, increasing evidence suggests that they are important to the host in both health and disease. There is mounting interest in mucosal biofilms in the colon, especially with respect to their role in inflammatory bowel disease, because bacterial growth in biofilms are more resistant to antibiotics than unattached organisms. It is often difficult to modify the structure and composition of these communities or to eradicate them from the body. However, recent work has shown that there is a considerable potential to alter the species composition of mucosal biofilms in a beneficial way using symbiotics. Natural antimicrobials. Scientists develop natural protection for stored foods. Okay, this is August 21st, Health Day News. Natural methods of preventing food contamination and spoilage could greatly expand the shelf life of products, food scientists at Rutgers University. The researchers used natural antimicrobial agents developed from sources such as cloves, oregano, thyme, and paprika to create biodegradable polymers or plastic designed to prevent the formation of bacterial biofilms on food surface and packaging. This is very useful. Cloves, oregano, thyme, and paprika, definitely good essential oils to know, and we actually use them in our research for treating Morgellons, not only in the form of essential oil, but also in some cases internally and for the teeth and gums. Step 1, lysis detachment, empty stomach. It gives you the enzyme. When we come back, we're going to actually cover the biofilm protocol and how to deal with it in the body and in the gut lining.